Brought to you by GTA. We start with you.
It's definitely a nosocomial infection if you acquired it within the hospital, but as to the actual source, it's, we'll never know for sure.
GMH ICU and ER nurse Marnette Agabao was admitted to GMH in July and repeatedly tested negative for COVID.
But then had tested positive within the week that she had passed.
With the belief that Nurse Agabao caught COVID at the hospital and the increasing number of GMH frontliners testing positive,
I don't have the exact number with me.
what's the plan, and are discussions underway to move all non-COVID patients out of GMH to what's supposed to be the COVID-free hospital at GRMC to prevent further nosocomial infections? According to PAG's Dr. Felix Cabrera, that's up to GMH.
Physically, there's room there. But I'm sure they have their reasons, but we have yet to fully understand, how that outweighs the clear and present danger that exists for these special patients, and the risk of them acquiring a nosocomial infection, or in other words, a hospital acquired infection.
The increasing number of hospitalizations at GMH and the skilled nursing unit facility in Barrigada Heights still not open, as many, including Dr. Cabrera, acknowledging there should have been better follow-through in preparing for the second wave.
We've had months to prepare for this wave. Months. We've had a lull, and we have not done enough to prepare for this. And I think that that's very clear. And it's I don't know if it's because because it was more of a reprieve from the first wave that we had, and then trying to get caught up with a lot of things. But the key part here is that we had to sharpen the saw, and that we had to really look at what we needed to do to improve. And that's part of that was ensuring that SNU was brought up line and was ready to go for the next spike, because we made it very clear that we had no idea what would come, but when it did, it was going to hit us real hard and very quickly. And sure enough, it did.
Also ready to accept fault, Lieutenant Governor Josh Tenorio.
Yes, I would. Anything that is happening right now, obviously you take responsibility, both the good and the bad. And I'll just say that, I'm monitoring the situation with hospital capacity, and it's and all the different triggers that we're using to try and expand it. I'll tell you that the SNU is probably, we'll find out when I get on, but I'm pretty much certain that we'll be able to move about 11 patients over there in the next day or two. And that's coming back online. Part of it, I think, is delays or some red tape that I've seen, especially at the hospital, that love to cut up. But yeah, no, anything that happens, obviously we take responsibility, and we're managing a pandemic. We've not seen these kinds of things. And of course, we're managing the public interest and the special interest from the business community and the public sector, trying to pressure us to make changes on quarantine and openings. We'll do our best, and we'll continue to monitor this on a daily basis, and look forward to better times for the people. But I want to assure you that our mind is on this, and we will use every tool that we can to try and get everybody's safety and health back.
Reporting for Guam's News Network, I'm Sabrina Salas, Matanani.
Brought to you by GTA. We start with you.